Welcome to Babies and Bones. Click to subscribe below.
Don't forget to like and comment. Your comments can guide us on what videos we make next. Hey there everyone, I'm Dr. Nima.
And I'm Dr. Kate, and today we're going to talk about low back pain in pregnant women. When I was pregnant with my first Olivia and also with my second Scarlett, I had a lot of low back pain in pregnancy, and I wish I would have had some more exercises and tools to help me with that pain. So we're going to talk about that today. We have the Prehab guys here. We have Arash and Mike. They're back with us to help us with some exercises.
Yeah, actually, I mean, Kate's even underselling this. Like, I came home several times and she was literally on the bed crying because of her low back pain, and she couldn't take any anti-inflammatories, and it was a really difficult situation. It made it really hard, and we thought, wouldn't it be nicer if we could avoid this completely? And so I think doing some exercises before you get pregnant would be the ideal situation, and so we really hope Arash and Mike can teach us some of that for prehab before pregnancy, and then also during your first couple trimesters of pregnancy.
Yeah, exactly. So first we're going to talk about just a few causes of low back pain. What causes low back pain in pregnant women?
So the first thing, and as most women out there know, it's hormones. So as your estrogen, progesterone, and relaxin increase, that leads to joint laxity. So your joints are becoming a little bit looser. Then as you progress throughout pregnancy, your uterus is getting larger and larger. That causes your abdominal muscles to get weak, and your uterus starts to tilt forward, and your lower back actually starts to become concave or increase in lordosis. It means that shape of that U. Then the center of gravity shifts as the uterus enlarges, and that drops the pelvis forward. So I wish I had a pelvis around here. Ask and you shall receive. So here's a pelvis. This is the front side. This is the back side. So if we go to the side profile view, what happens is as the uterus enlarges, the pelvis drops forward. And as we were mentioning, the forward tilt of the pelvis is also because of these ligaments in the back called the SI ligaments, sacroiliac. They connect the sacrum to the ilium, and those loosen, causing your pelvis to even tilt more forward. So what does that look like on a human? Well, if my wife stands up,
sure, be our demonstration.
Her pelvis drops forward, and her lower back caves in like that, and you have a big U here. And that concavity, or that increase in lordosis, leads to lower back pain. So our goal is to find a way to increase the strength of your core so you have less low back pain during pregnancy.
Yeah. What are some of those risk factors for people that can have low back pain or that have a higher prevalence of low back pain?
So that's a really good question, Mike. So the number one risk factor is kind of what Kate mentioned. It's having back pain during a previous pregnancy. If you've had it once, you're going to keep getting it, or you're more likely to get it. Other risk factors include a high BMI, so your body mass index, being overweight. Additionally, if you're hypermobile, you've heard of people who are double jointed, which we will one day have a video on the term double jointed. But people who have more connective tissue disorders and are more lax, they are more likely to get a low pregnancy because their tissue and their ligaments can stretch. Low back pain during pregnancy, and also the increased age of the mother. So as you're older when you get pregnant, you have a higher likelihood of low back pain as well.
Right. So as I said, I had a lot more back pain when I had my second daughter, Scarlett. I was a little bit older. I had back pain with Olivia. So those are two of kind of the four things we mentioned that really put me in kind of a higher risk category.
Honey, you weren't old.
I was old, getting old. One of the other things that's frustrating as a pregnant woman is that you can't take NSAIDs or the ibuprofen anti-inflammatories, which we have actually another video on that you guys can check out. But it's hard because you have all this pain, and your kind of go-to medication is dangerous for your fetus, and so you can't have that medication. And so these exercises are really a way to kind of remedy that pain in a very natural and safe way. So should we talk about the exercise a little bit?
Yeah, but to preface all that, it's always important, if you have not done these exercises before you were ever pregnant, you should talk to your doctor and make sure it's okay for you to do them. And these exercises are more often used in the first and second trimester, right, fellas?
For the most part, yeah.
Yeah, because sometimes during the third trimester it can cause some issues. So just clear these exercises with your doctor, and hopefully they can help you.
Yeah.
Take it away, guys.
Cool. All right, so we're going to go over 4 different exercises here. So what we'll do here first is come on up, and we'll go through.
I'm going to demonstrate since I'm a woman and I've been pregnant. I feel like poor Nima can't really do it. Should I get
So
down on the
basically, going off of what Nima was talking about earlier in terms of the position, likely you're going to be in this position here. This is an anterior tilt, and your back's going into extension. So we want to focus on strengthening the glutes here, and then the core here.
Okay.
So this is a basic squat.
It's going to mirror you.
So what we're going to do for this squat is keep your feet hip width apart here, and then you're going to lower yourself down.
Back up a little bit.
Yeah, lower yourself down, sink into the heels a little bit, and then you're going to come back up. And when you come back up, you want to use the glutes to bring yourself back up.
Right.
Good, and we'll do a few reps of that. Good. How's that feel?
Good.
Yeah. So this is a very basic exercise you can perform anywhere. Make sure that your back doesn't go too much into this arched position here. You want to make sure to keep the core engaged as you perform this and use the glutes. So that's a basic one you can perform anywhere.
Ross, real quick, how many reps and how long should people do this?
Perfect. Yeah, so usually we'll start anywhere from 10 to 15 repetitions.
Okay.
And then based on how you feel. So if it's too much for you and your back starts hurting when you do this, you can go actually up against a wall and perform wall-supported squats. That's another option. But go based on how you feel. If you can perform 10, that feels fine, then go for 15. But if at 10 you start feeling that that's your max capacity, your legs start getting tired, then stop right around there. And we'll do a few sets, usually 2 to 3 sets of those.
Cool.
Let's go into clams next.
Sure, so the next one we're going to show is clams. You're going to be able to go ahead and lie on your side. Same concept that Arash said. The goal of the clam exercise is really to work the glutes. In this example, we're lying on our right side. We're actually going to be working the top glute. So step 1, what I like to say is tighten up your stomach the same way. Arash said you're going to notice that the cues are the same to get the glutes to activate. The first step is keeping that rib cage down, the core engaged in the front. Step 2 is you can go ahead and put your hands on your hips if you want. We will go this way. We want to have the fingers back here. That's where you want to feel the muscle work, not necessarily in the thumb, which is in front. So you can kind of give yourself your own feedback. You want to feel your fingers more so than your thumb. You're going to feel both, but we want more in the back. Once you squeeze both of those, you're going to think about rotating your hip up and then back actually towards me.
I feel like
And it should be a very intense, really intense contraction in the back of the butt.
Yeah,
What you may see some people do, some people will try to rotate, so that's something we don't want. And again, you have to focus on squeezing the back, not the front of the hip.
Where should these feet be? Because I notice if I bring them in, I get like more. To me, that like looks better because I get more motility. But it doesn't matter.
It's going to be different. It's going to be a wide range depending on what your hip structure is like and also what you're just used to doing.
Okay.
So I would say whatever feels comfortable. If some people like their knees a little bit higher, some people like the knees lower. Find out whatever you can feel the most in the back versus the front, and whatever works for you. We're all different. We're all individual.
Perfect.
All right.
To make it harder, you could put a band around it if you want.
A band around your knees here.
Yeah, same thing. Like Arash said, start with a couple sets, 2 to 3 sets. You can start 10 or 15. The goal is to get a burn. So if you're doing 5 and you're not getting a burn, bump it up to 10. But if you're getting that burn around 10, great.
I get it with like 1.
Yeah, we can start at 1 for now.
Don't let her
Work
fool
your
you.
way
She
up.
was a super athlete.
Perfect. All right, so the next one we'll do is a cat-cow. A lot of you guys are familiar with this, but we want to kind of go through the form. So hands under shoulders, knees under hips, and you're going to move the pelvis back and forth. You can see how the low back moves as you go through.
It's amazing.
Yeah.
You're really good at that.
Shoot.
It requires a lot of control. So this is not necessarily a strengthening exercise
Okay.
as much as it is a control exercise.
So you have hands under shoulders.
Yeah, hands under shoulders,
Knees under hips. And first you kind of
arch the back.
arch back
Good.
this way.
Arch. Good. And then if that hurts your back, especially during pregnancy, you're likely already in this position. Don't go too far into it. So go within your tolerance, and then now let's go the other way. And now you're tucking the tailbone underneath. Good. Rounding the back. You can see how this rounds the back like this. And what you're going to do is develop an understanding of where your back is in space. And then we'll go back and forth. So you'll know that this is where you likely are. And then what we want to do actually is go the other way and teach your body how to maintain the other position. That way when you're up, standing, walking, your body knows where it should be in space. Okay, now that we understand... Perfect. So, yeah, it's a lot more challenging than it looks, but you did it pretty well on that one. So what we'll do now is... Expert. So now that you understand how to move this, we want to maintain that neutral position, which is in between both the arch and the tuck. So you'll maintain that neutral position, and then we're going to integrate that clam exercise where you're bringing the leg out, and then you're going to kick back. So this is like a fire hydrant plus a donkey kick mixed together. And this is really going to get the outer glute muscles here, which is crucial. So you can scoot forward a little bit here.
For me, I think the hardest thing was just stabilizing. So
Yeah.
you want like a neutral spine, and then you come out
Yep.
this way, and then kick back.
And then kick back.
This
You
way.
should really feel the glutes here. So what we can do to actually challenge with this exercise is to put a water bottle on the back.
Uh-oh.
This is going to make sure that you don't compensate. Because what's going to happen likely is you're going to want to rotate away. Yep.
So they don't want to fall out.
The chest is going to open towards the leg that's kicking.
Okay.
Well, let's make this a little more entertaining. Let's take off the cap.
No, don't do that. I'm gonna.
All right, honey, don't let me down. Don't let me
I'm
down.
gonna get
All right, we'll do a
soaking
few reps
wet.
of this.
Is it really off?
It's off.
Oh my
You're
god.
doing
Kick
great.
out.
It's good. It's really
So you
good.
really want to squeeze the glute here. Where do you feel it?
In my butt.
Good. Perfect.
I do not
Yeah.
want to get wet.
Good. All right. Good. That was good. So same thing as the other exercises.
What a gentleman.
Yeah. I don't want to get you guys floor dirty. So same thing with the other exercises. 10 to 15 repetitions, 2 to 3 sets. See how you feel. If it's too challenging, start with like maybe 5, 6, 7 reps, wherever you feel like is your tolerance, and then work your way up. The key here is really just to get the body moving as much as you can to build those muscles, because the baby's only going to get larger and larger. And then if you want to hold the baby post-pregnancy too, you want to make sure you have the core strength to do that as well, right?
Get it
And
tight
so-
again.
Yeah, exactly. So with things like this, you can also integrate things like walking or non-weight bearing exercises like swimming or pool type exercises.
That's awesome.
Are also a great alternative as well, just to build up that aerobic capacity.
Awesome.
Yeah.
Well, so these exercises are super helpful. And my question is, how could a husband support his wife in this situation? Because I got to tell you, when I used to come home and deal with her low back pain, I had no answer, because my answer genuinely was anti-inflammatories,
Yeah.
because I want something to acutely take away the pain.
Mm-hmm.
What can I do to be more supportive? Or,
Yeah. Well, Mike.
You can join her. That's number one. You can join her.
there's no way I can do
Exercise.
that cat pose the
Yeah.
way he does it.
Not with the water.
Good for you. Even if you're not pregnant, these exercises are very good for you just from a prehab perspective for low back pain in general. Even more important when you are pregnant, but even if you're not pregnant, I would assume you're not. They're very, very helpful for you. And then being there supportive as a husband, and anyway, from an emotional standpoint.
Yeah.
Okay,
That's a good
so
point.
I hope you folks got some good new tips out of this. Oh, I learned a lot. I think the key here is to stay active and keep that activity ideally before you're pregnant, and then keep that going through your pregnancy, and just check with your doctor on what you can and can't do. Hopefully this helped you.
Yeah, I hope this helped. I wish I had done all these during my pregnancies.